Hello everyone, today we're going to be doing rapid revision on traumatology in forensic medicine. So what we'll cover today, we have mechanical injuries, regional injuries, transportation injuries, thermal injuries, electrical injuries, torture and explosions, and ballistics. Starting with the classification of mechanical injuries, we have blunt force, sharp force, and stab. Under blunt force, we have abrasions, contusions, lacerations, and fractures. Sharp force, we have incisions and chop wounds. Stab wounds produced by pointed weapons. Abrasions. We have multiple types of abrasions. The following are caused due to tangential force. We have a scratch abrasion where the it is usually caused by pointed objects such as a pin or a fingernail, or graze abrasion, also called a gravel rash or sliding abrasion, which is caused due to friction between the skin and a rough surface, most commonly associated with road traffic accident, and it shows multiple scratches over a wide area. But the direction of these scratches can be can be known by the heaping of epithelium at the end of it, also called as epithelial tag. Abrasions caused due to perpendicular force is called pressure abrasion, which is seen commonly due to ligature marks, or cases such as strangulation or hanging. Imprint or impact abrasion caused due to recoil abrasion or whip marks, and pattern abrasion, also called as imprint abrasion. We have abrasion, aging, and diagnostic clues. We have epithelial tag. Epithelial tag tells us about the direction of the force of the leading to the injury, which can be indicated with the tail end where there is heaping of epithelium towards the end of the abrasion. The aging of the scab color can be remembered by R squared, RB, B squared, which is red, which is raw, red, red brown, brown, black. Difference between antemortem and postmortem abrasions, where antemortem can be caused anywhere on the body, whereas postmortem is usually caused in a bony prominence. The color is red in antemortem and pale in postmortem. Vital reaction is seen in antemortem and not seen in postmortem. Diagnosis by abrasion pattern, we have abrasions around the nail abrasions and perioral injuries is usually seen in smothering. Presentic nail marks seen in throttling. Multiple graze abrasions are commonly seen in road traffic accident, and abrasions around the inner thigh and genitalia are usually seen in sexual assault. Contusion, also known as bruise, it is seen in blunt force trauma. It has ill-defined margins of the wound. There is extravasation of the blood in the dermis. It is extravasation of blood or collection of blood in the dermis, but without the discontinuity of the epithelium. We have multiple types of contusions. We have intradermal, deep bruise, ectopic bruise, pattern bruise. Intradermal are usually superficial. Deep bruise, also called as come out bruise, which are come after a while, also due to there is delayed appearance. Ectopic bruise, which it migrates from the site of injury to a different location. Pattern bruise shows the pattern of the striking surface. We have examples of ectopic bruise. We have raccoon eye, black eye seen in head injuries, battle sign seen in middle cranial fossa injuries. Next, we have pattern bruises and true versus artificial bruise. Examples of pattern bruise are six-penny bruise seen in throttling, butterfly bruise seen in child abuse caused due to pinching of skin. Tramline or railway track appearance is due to a blow with a rod, lathi, or stick. The difference between a true or artificial bruise: a true bruise is caused due to trauma, whereas artificial bruise is caused due to irritant plant extract, mainly Semicarpus anacardium or Calotropis. It can be seen anywhere on the body, usually accessible parts of the body. Color change is present. There is absent color change. Margins are irregular. Margins are regular. Vesication is absent, or vesication or blister formation, whereas blister formation is present. Itching is not present, whereas it is present in artificial bruise. And aging of a bruise and factors affecting the bruise, we have red color, blue color, brown, green, and yellow. Red caused due to oxyhemoglobin, blue caused due to deoxyhemoglobin, brown caused due to hemosiderin, green caused due to biliverdin, and yellow due to bilirubin. we have factors affecting bruising. We have more bruising seen in lax parts of the body, such as the scrotum and face, and high vascularity areas such as the face. Delicate subcutaneous tissue, typically seen more in females and obese individuals due to a higher fat content. Extremes of age, such as in children and elderly, and pre-existing disease. Less bruising is seen in good muscle tone and firm fibrous tone, such as the palms and soles. Multiple bruises of different color is a sign of child abuse. We have laceration with incision and a stab wound. We have laceration, margins are irregular, whereas incision, they are clean cut. We have a feature is swallowtail, which is seen at the end of the laceration, and tailing seen at the end of the incision, showing direction of force. Tissue bridges are present and absent. Floor is crushed, there is less bleeding. In an incision, the floor is cut, which leads to more bleeding. There's less bleeding and there's profuse bleeding. Stab wound is caused due to any weapon with a pointed end, and the maximum dimension is the depth. In incision, the maximum depth, length is maximum dimension is length. Types of laceration. We have split type laceration, also called as incise looking laceration, caused due to skin crushed between two hard objects, such as skull and tibia. Avulsion laceration is caused due to tangential shearing force, separating skin from deeper tissue, seen in degloving and scalping injuries. We have tear laceration caused due to semi-sharp objects, stretch laceration due to overstretching of skin, and lacerated looking incision, seen in skin folds, scrotum, and axilla. Hesitation cuts is also known as tentative, feeler stroke, or trial cuts. There is multiple superficial linear cuts at accessible parts of the body. It is indicative of suicidal attempt, but it is not definitive of a suicide attempt. Beveling is blade when the blade enters the skin obliquely and has undermined edges. It indicates homicide. Kiri is a form of suicide. Is a suicidal stab wound to the abdomen. It is an large L-shaped incision. There is hypotension leading to circulatory collapse, leading to almost spontaneous death. Chop wounds. These are deep gaping wounds caused due to heavy sharp weapon. The margins are regular with adjacent bruising. The floor is crushed and there is fracture of bone, usually seen with weapons such as an axe. Defense cuts, also called self-defense wound. Most common site is the first web space. Most common active site is at the palm of the first web space. Passive is seen at the ulnar margin of the forearm. Cleave Injuries caused due to at the cleavage lines. If the incision or stab wound is caused is parallel to the cleavage lines, it will be less gaping. Whereas if it is perpendicular to the cleavage lines, it's going to be gaping. Fractures of the skull. We have fissure fracture, which is the most common type of fracture. It is linear crack caused by a weapon with the broad striking surface. Depressed fracture is caused due to a smaller striking surface. The signature fracture is when there is a mark of the weapon left on the fracture. This can help in weapon identification. Pawn fracture also is a variant of depressed fracture, also called as indented or ping pong fracture, seen in infants due to elasticity of bones. Gutter fracture is due to oblique or glancing bullet. Comminuted fracture is due to multiple traumatic injuries leading to multiple fracture lines. Diastatic or sutural fracture, it runs along the skull sutures. We also have ring fractures, which is seen around the foramen magnum, caused due to force being transmitted through the spine. Can be caused due to a fall on the legs, a fall on the buttocks, or a heavy object landing on the head. Here we have as mentioned previously, we have ring fracture caused due to fall from height, seen around foramen magnum. We have hinge type fracture, which is caused due to sideway impact to the skull. Pippi's rule is a new fracture line will never cross a previous fracture line. It is used to sequence multiple fractures lines from successive blows. Group and contra-group injury. Group injury occurs at the site of impact, whereas contra-group injury is opposite to the site of impact. Most common site is occipital impact leading to frontal lobe contusion. It is less commonly seen at the occipital impact due to the smoother surface of the occipital bone. Intracranial hemorrhage. We have three main types: extradural, subdural, and subarachnoid hemorrhage. Most common source of bleed in extradural hematoma is middle meningeal artery. It is usually bridging veins in subdural hemorrhage, and it is arteries of the circle of Willis and subarachnoid hemorrhage. On CT scan, we have biconvex opacity seen in extradural hematoma, crysenteric opacity seen in subdural hematoma, and biconvex seen in extradural hematoma. And whereas subarachnoid hemorrhage, we have diffuse subarachnoid blood. We have causes can be caused due to trauma. Subdural hemorrhage we have can be seen in usually elderly people with minor trauma, boxers, and shaken baby. In subarachnoid hemorrhage, we have the mnemonic BATS, which we have aneurysm, AV malformations, trauma, and stroke. Lucid interval, it is a period of consciousness between two periods of unconsciousness. In a lucid interval, a patient is criminally liable for acts committed during this window, and a patient can provide valid evidence and will made is legally valid. Death due to failure of diagnosing lucid interval is falls under medical negligence and is punishable under 106 of BNS. Transportation injuries. We have bumper fracture. Most common is lateral condyle seen in the lateral condyle of the tibia. We have impact. We have windshield impact. We can be seen as sparrow foot injuries seen on the face as multiple cut lacerations from the broken glass. Whiplash injuries is caused due to hyperextension then flexion or extension first pattern is most dangerous. Impact on the steering wheel can be seen as a pattern bruise or sternal fracture or aortic injury. Seat belt injury can lead to mesentery or small intestine injury. Dashboard impact can lead to posterior dislocation of the hip, and impact on the car pedals can lead to ankle fracture. When the body temperature falls below 30 degrees Celsius, the hypothalamus stops functioning. Mild hypothermia is seen from 35 to 32 degrees Celsius. 32 to 28 degrees Celsius is moderate hypothermia, and severe is less than 28 degrees. Here, at moderate hypothermia, shivering stops, and J waves are seen on the ECG, and there are low reflexes. In severe hypothermia, there is paradoxical undressing, which a patient paradoxically feels very hot and starts to undress all their clothes, and it can typically be seen as a dead body lying in the open, which may mimic a sexual offense case. And hide and die syndrome is where a person it can maybe the dead body may be found in the cupboards or in the basements, which may mimic a homicide. Frostbite due to exposure to freezing temperature. There is seen at periphery such as the fingers, feet, and tip of the nose. Progression, we have pallor followed by erythema, then gangrene. Treatment is rewarming. Heat-related syndromes, we have heat cramps, heat syncope, and heat stroke. Heat cramps is caused due to sweating causing loss of sodium, which leads to muscle cramps. Heat syncope is due to loss of sodium and water leading to hypoperfusion, leading to syncope. Heat stroke is caused when the body temperature is greater than 40.5 degrees Celsius. There is CNS dysfunction. There is increased heart rate, decreased blood pressure. Pinpoint pupils, sweating is usually absent, and autopsy shows postmortem caloricity. Burn surface area can be measured using rule of Wallace, London Browder chart, and rule of Palm. Autopsy findings seen in burns. We have heat stiffening. Due to this is coagulation of muscle protein leading to stiffening seen as boxes or pugilistic attitude of the dead body. Rupture, we have skin cracks or splits from the heat. They may mimic a incised wound. Heat hematoma is blood clot in the extradural space. Here there is chocolate brown appearance of the blood and honeycomb appearance. Heat fracture is long bone fracture or skull fracture, also seen as street and avenue fracture pattern. Specific signs can be remembered by the mnemonic FIRE, which is fluid in blisters, inflammation, redness, and increase in enzymes. And crow feet sign is sparing of skin around the eyes, feature of antemortem burns. Due to closing of the eyes leading to wrinkling of the face skin. Internal signs we have carbon deposition or soot in airway, increase in cyanide, and increase in carboxyhemoglobin in blood more than 10 gram percent. Burns are caused due to dry heat, scalds due to moist heat, and chemical burns due to corrosives. Charring and singeing is seen in dry heat burns. Soddened or bleached skin is typically seen in scalds. Ulceration is seen in chemical burns. Lines of blisters are seen in scalds. Splashing is seen in scalds due to liquid. Clothing is burnt in dry burns, and the clothing is intact but it may be wet in scalds. And there is staining of acid in chemical burns. Electrocution and lightning injuries. Electric, the factors affecting the severity. We have AC current is more harmful than DC. We have the voltage and amperage is directly proportional to the injury of severity of the injury. Skin provides max resistance, followed by bone and moist skin. Cause of death. Cause of death in electrocution is can be cardiac arrhythmia or respiratory failure when if the current passes from head to foot. Uh, Molten calcium phosphate can be seen as bone pearls or wax drippings appearance. Low voltage. Low voltage burns are usually caused due to firm contact with the source, leading to joule burn. High voltage is due to loose contact and can be seen as flash burn or keratin nodule. Lightning strike injury is also called filigree burns. Lichen markings, arborescent burns, ferning, feathering, or keranographic markings. Filigree burns they appear red, pink, and do not follow blood vessels. Marbling is green and follows blood vessels. Marbling is seen is in the post-mortem change, decomposition, torture methods, or blast injuries. We have black slave, which is insertion of a hot metal rod in the anus. Cattle's prod is electric shock to the genitalia. Telefono, repeated slapping over the ears. Falanga is beating over the soles. Wet submarine is forced immersion of the head underwater. Dunking, forced immersion of the whole body underwater. Sawhorse is forced straddling. El planton is prolonged standing. Dry submarine is plastic bag asphyxiation. And parrot's perch or hog tying is where limbs are tied with body suspended. Injuries in explosions are caused due to the blast wave. Secondary are caused due to flying debris. Tertiary is caused due to wind or displacement of structures, and quaternary as seen as traumatic asphyxia or burns. We have most common injury in primary injury of explosions is seen into the air. Lung can be the most fatal, and we have GIT injuries. Secondary, we have flying debris. The flying debris we can be seen as Marshall's triad, which is abrasion, contusion, and laceration. This is a Marshall's triad. Tertiary can be seen as fractures caused due to displacement of structures. Firearms and their classification. Ballistics is the study of firearms and their effects. Internal ballistics is the study of the structure of the firearm and the motion of the projectile within it. External ballistics is the motion of the projectile in air after firing. Terminal ballistics is the effects of the bullet in the target and the wound produced. Parts of a firearm we have stock, handle, breech, barrel, muzzle. Classification is based on the inner surface of the barrel visualized by a helixometer. We have rifle gun, a smooth bore gun. We have choking of a gun and paradox gun. The rifling is the spiral grooves on the barrel. These spin the bullet, increase stability and projectile range. Smooth bore gun have such a shotgun. They disperse lead shots, leading to increase area of contact. Choking narrowing the terminal end of the barrel, which decreases dispersion, dispersion of the shotgun. And a paradox gun is a smooth bore gun with terminal rifling. Ammunition and gunpowder. For a shotgun, we have lead shots. Middle has a wad which travels approximately 2 meters and may cause a minor bruising. The functions are lubrication. So it separates the gunpowder from the shots, and obturation. The base is gunpowder. And for a rifle, it has a bullet casing. Wad is absent as the bullet sits directly over the gunpowder. Types of gunpowder. We have black gunpowder, which is low energy, high smoke. It is potassium nitrate, charcoal, and sulfur. Smokeless gunpowder contains nitrocellulose, nitroglycerin, and nitroguanide. It is high energy and low smoke. Depending on the fineness, we have FG, FFG, FFFG, and FFFFG. If the more number of Fs increases the fineness, which is increased ability to burn. Primer can be remembered with the mnemonic blast. We have barium nitrate, lead peroxide, antimony sulfide, styphenate or lead, and tetrazine. These are the identification of injuries based on the range. For contact injury, we have stellate or cruciate margins can be seen if there is contact injury. If the injury is caused in close range, we have black burning scene, blackening scene, tattooing scene, and also wound collar scene or abrasion collar. If it's within near range, we have only blackening, tattooing, and wound or abrasion collar. If it's intermediate range, we have only tattooing and abrasion collar scene. And if it's distant shot, we have only abrasion collar scene. Tight contact on bony prominences, we have hot gas diffuses between the skull and the skin, which ruptures the skin outward and can be seen as a cruciate or stellate wound. Shotgun, close range can be seen as stellate or cruciate margins. Close range, we have a single mass, we have burning scene, blackening, tattooing scene. If it's near range, we have central single hole with shots as single masses. Intermediate, we have dispersion begins, and we have central hole and satellite holes. And distant, which is more than 4 meters, we have complete dispersion of every pellet. Difference between entry and exit wound. Entry wound is inverted, whereas exit wound is everted. There is burning, blackening, and tattooing seen at the entry wound and not at the exit wound. Grease and abrasion collar will be seen at the entry wound and not at the exit wound. The size of the entry wound is smaller than that of the exit wound. Bleeding is less in the entry wound and more at the exit wound. Atypical bullets. We have semi-jacketed or dum-dum bullets. We have exposed lead tip, which mushrooms on entry, leading to greater damage. Ricocheting bullet stops spinning on hitting as an on an intermediate surface. There is no abrasion collar seen. There is no flame, smoke, or gunpowder effects. Tumbling or yawning bullets, where the bullet rotates end to end, it has an irregular path. Tracer bullets are luminous metal base which traces bullet path. Souvenir bullet is retained in the body and can lead to chronic heavy metal poisoning such as plumbism. Kennedy phenomenon is iatrogenic alteration of a gunshot wound, which makes it difficult to determine the range. Beveling of the inner table is seen in the entry wound and beveling of the outer table is seen in the exit wound. Gunshot residue test can be remembered by the mnemonic firing hands. We have flameless AAS, Harrison-Gilroy test, atomic absorption spectrometry, neutron activation analysis, dermal nitrate test, and SEM-EDSA. And that's it for traumatology. Thank you.